Good afternoon. I'm Keith Thompson. Jose and I have now worked with the MedCura Health team for the past 4 years to bring ophthalmology on site to MedCura Health patients. To do this, we've developed the HealthDigital.ai telemedicine platform to deliver outpatient services where they are needed to address the big problems in healthcare of increasing access, enhancing quality, and reducing costs of outpatient healthcare services. So we had our roots in the Georgia Tech Incubator program. This is Jose and I and his engineering team on the Tech campus working on an early iteration of the system. My background, I'm an ophthalmologist by training, and I was on the faculty at Emory as a professor of ophthalmology for about 15 years. My career is a little unusual, and then when I was at Emory, I co-founded a technology startup in the laser vision space backed by a local venture capital firm, Norrell Mosley Partners. And we did well with them and had a successful exit for our investors. And subsequently, Jose and I co-founded HealthDigital.ai. Jose is a biomedical engineer by training. And he's also had significant experience in public health and epidemiology in the renal dialysis space. Jose has also served senior roles as Chief Technology Officer for venture capital-backed startups with successful exits, and he's now HealthDigital.ai's Chief Technical Officer. So why is there a need for on-site ophthalmology for MCH patients? Let me tell you about one MCH patient we encountered shortly after we set up operations in your clinic to put a human face on what happens when patients lack access to the medical services that they need. Let's go inside the clinic and meet the patient. Call this patient Mr. S. Today, Mr. S is waiting to see his primary care provider in the Stone Mountain Clinic. He is typical of elderly patients in this demographic, 71 years old, Jamaican heritage, and he has a number of medical problems, including diabetes, which is insulin dependent and somewhat difficult to control, hypertension, heart disease, low back pain, recent onset of hearing loss, and he wears glasses to drive. Very typical of patients with multiple chronic conditions that Dr. Uzzle's team must address. Recently, his diabetes has been difficult to control, so he's been seeing his PCP every 3 to 4 months, and after several adjustments to his meds, his blood sugar is under better control, and that's good news. Unfortunately, the bad news is that Mr. S is going blind, and neither Mr. S nor his primary care physician knows that he has a sight-threatening eye disease. So why is he going blind? Mr. S is male, over 70, of Jamaican heritage, and has a number of systemic diseases that are risk factors for glaucoma, a painless progressive sight-eroding eye disease and one of the major causes of preventable blindness in the United States. If we could zoom into his eyes, we'd find the pressure is too high, and that caused irreversible damage to the optic nerve tissue and a painless progressive loss of vision over many years to decades unless the disease is diagnosed and the pressure lowered with drops, laser treatment, or surgery. So let's take a look under the hood and see how the Health Digital platform brings ophthalmology on site for MCH patients. First, we go inside the clinic and repurpose a few patient exam rooms to serve as a Health Digital access site. Within these rooms, we place a package of diagnostic instruments needed for comprehensive eye exams, including the latest technology for disease detection. Within this access site, medical techs and mid-level providers can run patients through these instruments according to specific workup protocols. Data and images from these diagnostic instruments are uploaded into Health Digital's cloud-based software. Without getting overly technical, there are 3 major components to the software system. Software known as PACS, or Systems or Picture Archive and Communication Systems, and an interface to the AthenaNet EMR. Then there's artificial intelligence and predictive analytics that help the ophthalmologist detect diseases. And then there's a telecom system that allows a remote ophthalmologist to consult with the patient in real time. So let's address encounter quality, because that's very important in a patient population with sight-threatening disease. If you're an at-risk patient, you want to get an eye exam that uses the latest technology for detecting disease and have a doctor with the necessary clinical skills. The good news for at-risk patients is there's now a technology available that has about a 95% sensitivity in detecting glaucoma. Now, some of you might recall that from his history that Mr. S wears glasses to drive, and you ask, well, he had to have an eye exam to get those glasses right, and if he got an eye exam, why was his glaucoma not detected? And the answer is yes, he did get an eye exam, but because he's price conscious, he went to one of the many retail eyeglass clinics that offers a free eye exam if you buy 2 pairs of eyeglasses. Well, these businesses are optimized to sell inexpensive eyeglasses, and they don't have the technology necessary to detect the latest technology to detect disease. So in Mr. S's case, his eye exam at the optical retail clinic missed his glaucoma, and his free eye exam ended up costing him a lot more than he bargained for. Sadly, more than 50% of MCH patients diagnosed with sight-threatening disease had previous eye exams in retail clinics that failed to detect their conditions. So the quality of the encounter is super important when we're dealing with patients with significant risk of sight-threatening diseases. What about encounter cost? If we do an apples-to-apples comparison of costs for an ophthalmology exam that uses disease detection technology, the average cost in a community ophthalmology clinic varies from $125 to $335 and average $250. Our costs at Health Digital range from $45 for self-pay patients on sliding fee up to $250 for private insurer, or $290, and averaged $120. So in our experience at MCH, what's the scorecard for delivering eye care with our Health Digital platform on-site versus patients' prior access to off-site care? In terms of access, we improved access from 7% to 70%, a tenfold improvement. In terms of quality as measured by disease detection, we've improved it from less than 50% to detecting almost all diseases, a change of twofold. In terms of cost, we reduced costs from $250 per encounter on average to $120, a reduction in cost by half. If we define value of eye care as access and quality per unit cost, then we've improved the value of eye care for MCS patients by 40-fold. We think this presents a compelling case for adding other specialty medical services to the Health Digital platform and make them available on-site for MCH patients. The latest information we have here on the number of specialty medical services is that MedCure's 70,000 annual primary care encounters generate more than 20,000 referrals for the specialty medical services listed here. If you provide us with expansion capital through a promissory note, we will be able to further enhance our eye care services and add other specialty medical services in need by MCH patients. We plan to enhance the ophthalmology offering and then add ENT, cardiology, pain, and dermatology to the platform, making these services available on-site to MCH patients. So it turns out that now is a really good time to expand our partnership. So if there was anything good that came out of COVID, it was that it prompted the government to clarify telemedicine reimbursement policy. So in addition to improving the quality of care for MCH patients, the expansion of this program can bring MCH a new source of revenue from origination site fees. So let me explain how that works. So during the COVID public health emergency, CMS relaxed the rules on telemedicine reimbursement. When the dust settles, it's nearly certain that the reimbursement rules for federally qualified health centers are going to be made permanent. And going forward, there's going to be 2 separate fees for remote visits. The first is called the origination site fee. For Medicare, it's about $25. It's about $20 for Medicaid. The origination site fee is billed by Medcura Health under the Q3014 code. We have proposed to Jeff that you provide us the space, the exam room space, we provide the technology and staff, and for all specialty medical visits, we originate from this site. We will split the origination site fee with MCH on a 50-50 basis. Now, the second fee is called the distance site fee. This fee is in most cases the same as that allowed for in-person visit, so-called parity. Now, and so this is billed by the medical specialist, and you don't have to worry about that. Medicare doesn't have to worry about that. Now, there's a catch to make this whole reimbursement program work. The Georgia telemedicine statute requires that the exam is of equivalent or better quality, so that's where the health digital technology platform comes in. We and our partner specialists ensure that we have the necessary technology and protocols in place to examine the patient in a manner that is equivalent or superior quality to an in-person exam. So I want to make sure that I cover some issues that Jeff asked me to address. So first, regarding our long-term plans and what's the longevity of this relationship if we expand it with MCH. Well, first, we've been partners with you guys for about 4 years, and I've just reported on the results of that partnership to bring ophthalmology to MCH patients. So we view that as a very successful partnership. Our hope and vision is that the delivery of specialty medical services to FQHCs through our platform is simply so awesome that every FQHC in the state is going to want one of our platforms and get their specialty medical services moved on site. And that really kind of becomes a new standard of care. MCH represents about 5% of the FQHC market in Georgia, where there's 35 FQHCs providing care to about 600,000 residents. So we see it for us as a great market opportunity to expand our platform to other FQHCs that will benefit in the same fashion as MCH has. So in this context, we view MCH as our launch customer. So we're super incentivized to do a great job for MCH. So, you know, if you get a call from a counterpart board member down in Waycross and says, you know, who are these crazy dudes from Health Digital, you'll give us a good recommendation. Also, I think that it'd be good for Jeff to talk to Alan Mosley over at Nora Mosley. They know Jose and I have invested in us, that they can speak to our integrity if you want a good reference. So questions concerning the promissory note that we're going to use for expanding services here. I told Jeff and Clayton we can make this a simple promissory note because there were some early concerns about your 501c4 or C3, whatever your nonprofit status is. It makes no difference to us. If you think our business has long-term upside, that this note could convert into equity at the point where we go seek external institutional capital, then you would have some upside in that. It's entirely up to the board on how you want that structured. Either way works for us. There was a question about security on the diagnostic equipment. We typically lease the equipment because it's quite expensive, and if we lease it, obviously the security interest is retained by the leasing company. So it's not. I don't think that's feasible with what we have budgeted for equipment. However, we could structure a security interest in our half of the origination site fee, which if we do the 5 targeted specialty services we have proposed, and that adds up to about 20,000 encounters per year, at $20 of revenue for each encounter, that represents a total value of about $400,000 per year to be split between us. So that would be this could be structured as a $200,000 per year security interest. So I think that's certainly doable. Also point out that all funds are going to be used to expand specialty medical services here at Medcura Health on the 5 services that we've referenced. And then finally, just a note about, you know, are we legitimate? Well, I guess 2 things. One, we have a 4-year record as partners with you guys, and second, I would encourage Jeff to give Alan Mosley over at Nora Mosley Partners a call he knows Jose and I very well, has invested in us before, done well. I think they can speak to our integrity. There were some questions about the software development task, implementation schedule, and software licenses, and Jose is going to address that for you now. So here's the status of our lining up our specialty partners. Obviously, ophthalmology is already covered. I'm simply going to add ophthalmologist under my EIN, which we're already set up and billing for. We have an ENT practice out of Northside. Advanced ENT is ready to go. Alliance Pain and Spine is ready to go on that. We're in discussions with both cardiology and dermatology. They're ready to move forward. Their questions to us are, well, has MCH signed off on this expansion yet? And we say, no, we're still ironing out the final details. But let me just say this. I think there's not going to be an issue getting specialty practices to provide services through this platform. Everyone realizes this is the future. And we're very fortunate to be in Georgia where reimbursement is full. These specialty practices in overserved and competitive areas are looking for a new source of patients, and the forward-thinking ones are very excited about this kind of opportunity. And they're all willing to work under the sliding fee scale as we have with ophthalmology. So, quick summary, we have a proven telemedicine platform that delivers specialty medical services to your patients. I think it's certain that expanding the number of these specialty services will increase the quality of care for your patients. And I think it will also enhance MedCura Health's value as a patient-centric medical home by integrating the delivery of primary and specialty services. We now have the opportunity post-COVID to monetize those visits for you via origination site fees, and word-of-mouth referrals from these ophthalmology practice patients are attracting other patients to MCH primary care. Every week we get we generate a handful of new patients for MCH just by virtue of people, friends and family members needing a primary care medical home, and we connect them right into the primary care front desk. And finally, I think it gives you an opportunity to partner with us as we bring this platform to schools, nursing homes, and other access sites. And I've told Jeff and Dr. Uzzle about the opportunity we have in Milledgeville, where the Baldwin County school system wants us to put this platform in their existing school clinic. And then by doing deployments like this, it gives MedCura Health an option to grow in that fashion as well. I'd like to start with the big picture view of the problem that we are addressing, which is shown in this slide. MedCura's 30,000 patients require over 20,000 annual visits to multiple different off-site medical specialists, which creates an enormous amount of friction for patients to access needed specialty services. Before we started working with MedCura, it was so difficult to access off-site care that only 7% of MedCura patients referred to an ophthalmologist had the eye exam completed and documented. Health Digital Telemedicine Platform reverses how specialty medical encounters are delivered to MedCura Health patients. The Health Digital Platform provides an access site in the MedCura Health Stone Mountain Clinic where diagnostic tests and patient physical examination are digitized. Remotely located specialists can perform their encounters through the Health Digital telemedicine platform over the internet. This takes an enormous amount of friction out of the healthcare system and provides needed specialty services to MedCura Health patients directly in the Stone Mountain Clinic and when the service is needed. These are comprehensive encounters that qualify for full reimbursement under CMS rules and the Georgia telemedicine statute. So we asked the question, instead of requiring the patient to visit multiple off-site specialists, what if we created an access site in the MedCura Health Clinic with the right set of technology that would enable primary care patients to consult directly with the specialist they need through the internet? And this would be a comprehensive encounter that qualified for full reimbursement under CMS rules and the Georgia telemedicine statute. To us, that seemed like a much better way to provide access to high-quality specialty medical services needed by primary care patients, and that is what the HealthDigital.ai platform does.